Officer of Health, Dr. Eileen de Villa. Please go ahead, Dr. de Villa.
Thank you, Lenore, and good afternoon, everyone. Today, there are 33 new COVID-19 infections in Toronto. To date, 14,350 people have recovered, an increase of 21 since yesterday. First, today I am pleased to share that our provincial colleagues at Ontario Health are supporting community pop-up testing sites in our city again this week. Testing will be available at the Sheridan Mall parking lot, located at 2200 Jane Street, on Thursday from 3 in the afternoon until 7 in the evening, and at the Jane Finch Mall parking lot, located at 1911 Finch Avenue West, on Friday, also from 3 in the afternoon until 7 in the evening. Thank you once again to our colleagues at Ontario Health and to the community leadership in the Black Creek and Downsview areas for this important initiative. We've now been in Stage 3 of the provincial reopening framework for nearly a month, and I'm pleased that Toronto continues to see lower COVID-19 numbers in our city. This is good news for us, but we can't take this progress for granted or mistake it as being back to normal. We're not, and we must remember that. There are still about 20 or so new infections reported locally each day. My team and I are watching what is happening in other cities that have reopened before us. Please know that we still need to be very careful and continue to follow the public health advice. The importance of this cannot be overstated. We anticipate some increases in COVID-19 activity as people are moving around and resuming activities that were paused in earlier months. We also know from the experiences of other cities in Canada and around the world that rates will climb back up unless we keep following the public health measures we've put in place to keep everyone safer. With this in mind, today I'll share a brief update on our data story during the first wave of this pandemic, actions we took to protect your health and save lives, and what we've learned to inform our planning to keep everyone safer as we move forward living with this virus. Since we had our first COVID-19 case on January 25, there have been 15,808 people diagnosed with COVID-19 in our city. My team has followed up with each of these individuals and their close contacts to collect information. Of these COVID-19 cases, 14,350 people have recovered, and tragically, 1,165 people have died. Our data tells us how COVID-19 is impacting residents and is informing our planning for future virus activity. To date, approximately 90% of residents have recovered from their illness, and 12% were hospitalized. Just under 3% were admitted to intensive care units. And sadly, 7.5% of people infected with the virus died. Overall, most of the COVID-19 infections in Toronto were attributed to close contact with someone who was infected with the virus. It is also important to remember that we learned that COVID-19 has had a greater impact on the people in our community who face greater health inequities and in households that could be considered lower income. Through our analysis, we know that the median age of people infected with the virus in Toronto was 44, and that males and females were affected relatively equally. Over these past months, my team and I have done our very best to protect your health and to save lives. As our situation changed, we scaled up our local response, and we acted to expand our case and contact management function significantly, to build a new data system to help us manage an unprecedented outbreak in scale and in magnitude, and conduct area-based data analysis to determine if the virus was impacting some groups more than others, and to target specific prevention measures to keep these residents safer. Since then, as a result of the steps we took and the way the people of Toronto responded, local cases declined steadily. And so when the time was right for our circumstances locally, we were able to join other parts of the province in stages 2 and 3 of reopening. During this time, we've been working hard to prepare for a safer reopening of our city. We've developed many guidance documents to support businesses and community services, from restaurants and hair salons to community services and amenities like libraries. Our guidance documents address the unique circumstances of each of these settings, who've all had to adjust how they operate to reduce the spread of COVID-19. We also took additional measures to protect your health by implementing new mandatory mask bylaws in indoor public settings, setting out clear requirements for the safer reopening of restaurants and bars, working with local school boards on measures to keep staff and students safer when schools reopen, and continuing to collaborate with the province for the lead for testing to support targeted COVID-19 testing in areas of our city with increased virus activity. I know this pandemic has disrupted almost every aspect of our lives. I know that we are all feeling COVID fatigue, and we would like to put this pandemic behind us. I also know that so many people in Toronto and around the world are experiencing immeasurable losses as they mourn loved ones who lost their lives to this virus. It is a small consolation, but so far, we have avoided much worse situations observed in other jurisdictions. And we want it to stay that way. The reality is, all of us have to live with this virus and be very careful to prevent virus spread until effective treatments and vaccines are available. We must remember there are many jurisdictions that have had to take steps back after reopening. I don't want this to happen in our city. And it doesn't have to. If we all think about what we're doing, how it keeps us healthy, and how our decisions affect people around us. This highlights the continued importance of taking our public health measures seriously. To wash our hands, watch our distance, and wear our masks. These measures are simple ways we can all take care of each other. This is also why I think it is critical for us to pause and reflect on what we've learned, how things have changed, where we are today, and how we can try our very best to keep everyone as safe as possible as we live with this virus. As Mayor Tory shared last week, our COVID-19 data story has shifted. We are now seeing an increase in younger people becoming infected with this virus in our city. Over the past 2 weeks, we have seen higher proportions of cases amongst people under 40. This includes people who are 20 to 39 years of age, and yes, those who are 19 years of age and younger. I've also heard that many young people believe that they are not vulnerable to severe illness from this virus. I have heard this firsthand. As I've shared with you before, and this message bears repeating, this virus knows no boundaries, not income, not race, and not age. You may believe that because you are young and otherwise healthy, you will not suffer severe illness from COVID-19. But just last week, I was very sad to learn of Quebec's first death in a person under the age of 20. This person was otherwise healthy before getting infected with this virus. This, sadly, is tragic proof that COVID-19 can impact anyone at any age with devastating consequences. In closing, we all have a role to play to help our city stay safer. So please, continue to wash your hands, watch your distance, wear your mask, and take care of each other. I'll now hand it back to Lenore, and we'll be very happy to take any questions you may have.
Thank you, Dr. de Villa. We'll now take questions. As a reminder, each media representative can ask one question and one follow-up. Before we get to your questions, we also have staff on the line who can answer your questions as well. First up, we have Francine Copin with the Toronto Star. Please go ahead, Francine.
Good afternoon, Dr. de Villa. Looking at the increase in new daily infections for the past 2 weeks, the numbers don't seem to be in decline. And I'm wondering why the dashboard is still green if the numbers aren't in decline. So, you know, they were around 10, 20, 18 2 weeks ago, and now they're, 32, 22, 24, 41 the other day. How is it that the dashboard is still green with those kinds of, lack of decrease and some increases in there as well?
So Francine, thank you. That's an excellent question. And I'll just remind you and everyone who's listening that the dashboard is actually comprised of 4 different categories of indicators. And it's within one of those categories of indicators that we're looking at case counts. And in particular, we look at the 7-day moving average on new cases of COVID-19. So that is one indicator out of many. You will continue to see the dashboard move back and forth. And in fact, over the past several weeks, we've seen it move from green to yellow and back and forth. I anticipate we will continue to see that as we see more reopening activities and people mixing in various settings. I anticipate that we will continue to see this level of COVID-19 activity. Risk will go up as more and more people interact with each other. I think that's the very simple reality of our circumstances. That's why it's so important that we continue to maintain those public health measures as much as we are tired of doing so. And as much as I mentioned, we all want to put this pandemic behind us and think about it as something of the past. The best way we can get there is to continue to practice those public health measures that we have been doing for the last several months. Watching your distance, wearing your mask, washing your hands, and certainly staying home if you are unwell. These are the kinds of activities that have seen us through thus far, and the kinds of activities we're going to continue to need to engage in on a go-forward basis if we are to try and keep our city as safe as possible and in the green.
Francine, did you have a follow-up?
And yeah, follow-up question. At what point do you have to start making different decisions? At what number do you have to start perhaps reimposing some of the measures that we had to deal with earlier in the pandemic?
Again, a very good question, Francine, and I don't know that there is a simple, singular answer to that question. Certainly, we will continue to monitor the new cases as they develop and as they are discovered and reported through testing. But it is much more than that. There are, again, I would say 4 different categories of indicators, and it is the sum totality of those that we need to look at in order to determine what the next best course of action is. Fundamentally, what we're trying to do is to protect the residents of the city, and particularly those who are most susceptible to the negative impacts associated with COVID-19, those who are older, those who have pre-existing chronic conditions. But there isn't a singular answer, and there isn't one single indicator that we're looking for. We are constantly observing, yes, new cases, but also watching what is happening within healthcare. How much testing is happening, what sort of public health capacity do we continue to have in order to make the best decisions around how to mitigate risk. But I think we need to be very, very clear. There is no zero risk scenario. Until such time as we are actually able to have more widespread effective treatments and certainly effective vaccines, there is no zero risk scenario. The question is, how best do we mitigate risk? How do we use all of our public health measures in order to mitigate risk as best as possible so that we can live safely with this virus? And the public health measures are fundamental to that.
Our last question today goes to Lauren Pelly with the CBC. Go ahead, Lauren.
Welcome back, Doctor.
Thank you.
I wanted to ask if you've heard any updates on saliva testing in schools. I know that recently Toronto Public Health has been calling for this and a lot of back and forth with the feds and the province potentially. So, you know, any more updates on that front? Is this something that you hope to see happen at some point in the upcoming school year?
Well, we're certainly hopeful. We wouldn't have made the recommendation otherwise, and certainly we are hearing more and more about this this methodology of testing in other jurisdictions. As you just pointed out, I'm just back, haven't had an opportunity to get into any discussions with our provincial partners on this particular issue, but I will certainly look forward to those discussions. I think, you know, managing school reopening is of primary concern to our provincial partners. It certainly is of concern to us and to our school boards. So I look forward to having conversation with our school boards and with our provincial partners on how we do that and how saliva-based testing might actually support that.
Lauren, did you have a follow-up?
Yes, and how comfortable are you right now with the plans that are in place when it pertains to high-risk schools in vulnerable neighborhoods where we've already seen a lot of COVID-19 activity? You know, is there anything more that you think needs to be done at this point to protect students in those areas?
Well, you know, I think there's always more that we can do, and I think there are things that we constantly need to be learning about. And I think, to my mind, the most important thing is to put the best plan available in place, to use our resources wisely, and to be prepared to change course when and if the circumstances dictate the need for a change in the course of action. What I can tell you thus far, having just returned, is that I know there's been very substantive conversation amongst Toronto Public Health staff with local school board partners, and I know that our colleagues at the province are also very actively engaged in this conversation and are interested in doing the best we can to support a successful reopening of our schools. We are watching very carefully what has happened in other jurisdictions, recognizing that our circumstances are unique and different. They may not be exactly the same as they were in the many other countries. You know, we're looking at the European experience, at the experience of many other Asian jurisdictions, I should say, as well. And our circumstances may not exactly mimic those situations, but there's much that we can learn from them. So how do we incorporate those lessons learned from other jurisdictions? How do we take into account our own unique circumstances? And how do we use the best available science? So what we know works: physical distancing, wearing masks where possible, washing hands, all the basic public health measures that have seen us through the pandemic thus far will need to continue to be applied and, as necessary, perhaps amped up in certain circumstances. But I think we need to keep an open mind, keep conversation constantly happening, and use the best available science amongst all partners to ensure that we're doing the best for our students and for the staff who work in our schools.
Thank you, Dr. de Villa. That's it for today, everyone. Our next media briefing will be on Wednesday. Thank you and have a great afternoon.